get updates on road closures from the Department of Transportation Development at 511la.org. As of this morning, and we're getting back to a COVID briefing now, but it interplays, I'm sorry, this is a LARA briefing, but COVID is implicated, as is Tropical Storm Hurricane Delta. Right now we have 6,613 people who continue to shelter in Louisiana because of Hurricane Laura. And because of COVID, they continue to shelter in non-congregant shelters. We are consolidating the hotels down to 12 hotels. That'll be finished by tomorrow. 10 of those will be in New Orleans. One will be in Baton Rouge area, and one will be in the Lafayette area. At this time, there are not plans to move Hurricane Laura evacuees again in advance of Hurricane Delta. In light of the current forecast for the storm, it does look like we will need to pause COVID testing on Friday and Saturday in the New Orleans and Greater Baton Rouge areas, but we will have more information about exactly where this testing will be paused tomorrow and on Thursday. Obviously, we're going to continue to monitor the situation and keep you updated. We really hate turning off our COVID tests because it is really important for us to know what's going on at any given time with respect to the transmission of the virus, the positivity of certain populations and all of that. And testing really is the way we try to stay on top of that. So we will not turn it off any more testing than is necessary, and we will make sure that we resume testing as soon as we possibly can. While we're talking about COVID, I'll go over the numbers that we released for today. That is 506 new positive test results. So that's 506 new cases on 12,760 tests. Unfortunately, we're also reporting 6 new deaths today. Currently, we have 567 COVID patients in our hospitals. That number is up by 49 over the last 2 days. It was up 29 yesterday and 20 today. Now, as I always say, a couple days doesn't necessarily make a trend, but we're keeping an eye on those hospitalization numbers because those are ground truth numbers. Those people are in the hospital, they've been diagnosed with COVID, and obviously we don't want the number of people in the hospital with COVID to continue to increase. As you are aware, my current Phase 3 order expires on Friday. We're going to have an update for you on Thursday about the order that will replace it. And of course, on Thursday, we'll be giving you a lot of information, I suspect, as it relates to COVID, to Laura, and then principally on Hurricane Delta. And as we said during Laura, and it bears repeating because it's incredibly important, we're going to be preparing for and responding to Hurricane Delta during a COVID public health emergency. And necessarily, whether we want it or not, there will be tens of thousands of people moving about the state of Louisiana, either as voluntary or mandatory evacuations, as people who are pre-positioning to make sure that we can restore power. Shortly after the storm, you're going to have people coming in and so forth. It is really important that we do everything we can to follow all of the mitigation measures that are in place to slow the transmission of this virus and to reduce our cases and hospitalizations and obviously our deaths. I am very, very appreciative of all the people in Louisiana, and by the way, of all the people who came into our state in order to help us respond to Hurricane Laura, because we have not seen as of yet a surge in cases or in positivity. And so that means the mitigation measures do work. And it's really important that we continue to wear our mask or other face covering, especially when we are in the presence of people who are not part of our immediate household. It's also important to maintain 6 feet of distancing with people who are not part of your immediate household. It is really important to wash your hands frequently with soap and water. If you're sick, stay home. And remember, we should always protect those who are most vulnerable to this disease. Those are people who are 65 and older, those people who have comorbid health conditions like heart disease, kidney disease, hypertension, diabetes, obesity, and so forth.